Lockie says, ideal squat position, i.e. what are the common faults with people's overhead squats? Okay, firstly, there is no ideal position. There's no ideal position or gold standard or perfect position for any person with any movement, because there are so many individual differences and intra-athlete differences, both in terms of movement patterns, in terms of soft tissue, flexibility, activation patterns, but also because of the skeletal system and changes in the structures of joints in different people. So there is no perfect overriding ultimate technique. There is no gold standard. However, there is a gold standard for the individual, and there are some common themes that we can look at across different exercises, different movements, in this case the overhead squat, that we can tick those boxes to make sure that we're on track. The first thing is a neutral spine. So being able to maintain that basic square or rectangle of position from shoulder down to the base of the pelvis, not having any separation of the lumbar spine from the pelvis. So making sure that you have a lot of midline stability here. And again, across the vast majority of exercises, this is a key tenet to make sure that you're working from a stable base. The second thing is some sort of abdominal bracing. Now this acts to help to maintain that neutral spine. So being able to lock the rib cage down to the top of the pelvis by activating through the abs to make sure that you're not getting an elevation of the rib cage and therefore a hyper extension of the lumbar spine. In line with this as well comes some sort of gluteal activation or bracing. Now, you cannot overhead squat with your glutes activated, or at least with your glute medius activated, because the entire act of squatting involves some sort of hip flexion. And if you're squeezing your glutes, you cannot flex at the hip. However, a gluteal activation in terms of those prime movers of the glutes, your glute max, is necessary to get into a neutral spine position in the first place. So I find with athletes it's really useful to get them to squeeze their glutes, which puts them in a slight posterior pelvic tilt, which in actuality is probably putting them in a more neutral position than they're used to. Then using the abs to lock the rib cage down. So the glutes put you in position, then the abs keep you in position. Then we have to look at the scapulae, having good scapular stability. Again, having good stability so that our body is strong, the core of our body is strong, and then we're able to generate waves of force extending out from our midline. So ensuring that your shoulder blades are active and not just sitting in a passive position. Again, a common theme to most of the exercises we can look at. Then the final thing is creating some torque. So in the case of an overhead squat, we want torque on the ground and torque on the bar. And basically torque is where you are trying to generate a rotational strength, but there's not necessarily any movement there. So imagine you have a spanner and you're trying to loosen a nut or you're trying to loosen a bolt and you're not actually able to move it. You're generating a rotational strength, but there's no movement there. And there's a lot of tension in the system, which gives a lot of stability. Now, again, in the case of the overhead squat, we're looking to create torque in two ways here. We're looking to create torque on the ground by screwing the feet into the ground, which activates the glute medius, causing a slight abduction and external rotation of the femur, which will cause the knees to track out as they should. Then we're also trying to create an external rotation torque on the bar. This can be cued by trying to rotate the elbows forward, the armpits forward rather, which is going to create a torque on the bar, a strength on the bar, both creating this torque and then actively pressing it up towards the roof. So these are our key tenets of movement that we can apply to pretty much any exercise we do. That being said, let's look at the overhead squat as a diagnostic tool. As far as I'm concerned, the overhead squat is probably the gold standard, the ultimate diagnostic tool to be able to diagnose almost any musculoskeletal dysfunction. So we can follow this three-step process. Firstly, we have to visualize or identify that there is a fault with movement. Then we have to identify what it is that's causing that fault, the underlying musculoskeletal activation patterns. Maybe something is too tight, too short, too weak, too loose. There's some sort of structural abnormality there. And then finally, we can diagnose exercises to fix that. So let's delve a little deeper into the overhead squat, start from the ground up, look at some of the most common problems we see, and then explore how we can use each of these problems as a diagnostic tool and ultimately as a tool to be able to prescribe some sort of fix. So starting from the ground, if you have an athlete who is squatting with their feet turned out too much, So the toes are splayed out really wide in the squat. It's normally a protective mechanism to try and work around a tightness through the Achilles, through the heel cord, through the soleus in particular. All those structures around the back of the ankle. Because what your body tries to do is find a path of least resistance, find an easy way to do the movement. And if you have tightness through ankle dorsiflexion, as you're lifting it up off the ground, as you lift your toes off the ground, some sort of tightness there, you're able to hide by the fact that you're turning your toes out. Now, in and of its own, this is okay. However, and you guys can try this, if you stand with your toes pointed forward, so your feet are parallel, and then try and screw your feet outwards into the ground, you'll feel your glutes kick in and you'll feel some activation through your hip. And you'll see that your knee begins to track out a little bit. Now turn your toes out as far as you can. So you're now in like a ballet position with the toes turned out. Now try and screw the feet into the ground. And you'll find that you just can't access any muscle activation because you're at the very end of that length tension curve. Your body is not able to generate power at extremes of muscle length, either fully contracted or fully extended, and that's what's happening here. So you have athletes who have tightness through their Achilles, they turn their toes out as they're squatting, they're then not able to generate torque. So they can't generate that strength and that activation through their glutes. So starting from the ground, that's the first thing we can look at. Then if we travel up to the knees, with the knees, as the knees track, you'll see sometimes the knees fall in with people. Now this is a symptom. This is not the problem itself. So they don't necessarily have a problem with their knees, although it can lead to a long-term chronic overuse issue with their knees. The problem here is that they're not generating the torque that we've just spoken about on the ground. So quite often you'll see athletes who have their feet turned out a lot, but they still won't be able to get their knees tracking out because they can't generate the torque. So again, the knees falling in are just a symptom. Just like if you have chickenpox, the symptom is a mark on the skin, but the underlying issue is a virus which is causing those symptoms. So what's the virus in this case? Well, the virus is the athlete not screwing their feet into the ground. It's either caused by purely a coaching cue, screw your feet into the ground, or a tightness through the muscles responsible for pulling the knees in, things like your adductors, or a weakness in the muscles responsible for pulling the knees out, which is the pelvic stability, the glute medius. So we can diagnose an issue based on an athlete's knees falling in as either a tightness through the adductors in their hip or a weakness through the abductors and lateral or external rotators through their hip. How do you coach this? How can we fix this with a simple coaching cue? Push your knees out is perhaps not the best cue. This is like putting a band-aid on a chickenpox. It's not solving the underlying issue. However, screwing your feet into the ground can be a great cue, and you'll see as a result of that, the glutes activate and therefore the knees will track out. You're not cueing the knees, you're cueing a solve, a fix to the underlying virus, the underlying problem that's causing the dysfunction there. And this should always be your first port of call. Can you out-coach poor mechanics? If not, if you're cueing an athlete to screw the feet into the ground, maybe you even try telling them to push their knees out and they can't physically do it, then it becomes a time to be able to diagnose an actual dysfunction of the musculoskeletal system, and then you would prescribe some exercises to do maybe post-training to eradicate those issues. Now let's travel up to the pelvis. If you have an athlete who is not able to hit full depth without losing neutral spine, again, the first thing to do is to look at their Achilles and see if their ankles are moving. If they are, then you can start to look at some of the mechanics around the hip. Now, if the knees are tracking in, so you'll see this still relates to the previous steps that we've looked at. If the knees are tracking in, sometimes the femur, that thigh bone, can come up, contact the front of the pelvis and cause that posterior pelvic tilt. Now, you remember we talked about the importance of maintaining neutral spine. So it is really important at this point that those knees are tracking out to allow the femur to move past the front of the pelvis to keep the spine as neutral as possible. Now this can be caused by the shape of where your femur joins in to your hip in the acetabulum there, because there are a lot of different shapes and different sort of connection types across different people, which is why there is no gold standard. But you can look at whether the hip joint is tracking and gliding and sliding properly and moving correctly. Again, if this is an issue for you, this is something that you should get looked at on an individual one-on-one basis. We travel up to the thoracic spine. If the athlete is coming forward too much and it's not an issue with their Achilles, So their Achilles and their ankles are moving well, which allows their knees to come forward and keep the torso nice and vertical. If it's not an issue there, we're looking at a tightness through the thoracic spine. The tightness through the thoracic spine manifests as the body being pulled forward. Now what this can often do is transfer a little bit further up the line to the shoulder as well. So athletes who have a tightness through their thoracic spine, they have to then change something at their shoulder to be able to compensate for this, because the body is really good at finding a way to make things work. And what often happens is the shoulder then internally rotates, the shoulder rolls forward, and it therefore rolls out of this active position that we've already talked about, and it's no longer generating torque. So if the shoulder rolls forward, it's no longer in a stable position. And not only are you then less strong and less efficient, you're also predisposing yourself to injury at the shoulder. Again, this applies to a whole range of different movements, and we can look at exactly the same thing in something like a kipping pull-up, which is one of the reasons that that movement gets a bad rap, because we're allowing this internal rotation of the shoulder at the front of that kip. So if there is tightness through the thoracic spine, the body moves forward. We need to keep the bar back though, because if the bar comes forward as well, we're not physically able to do an overhead squat. So if there is tightness through shoulder flexion, that's lifting the arm up to the front, if there's tightness there, the only way we can actually get that bar back into position is by internally rotating the shoulder and then predisposing to shoulder issues. So you can see, guys, we can break down a movement, look at the different parts of it, and actually use a movement to be able to diagnose faults and issues. And I really do think the overhead squat is the absolute king of doing this.